Hello, this is Dr. Molly Hart with Pelvic Balance Physical Therapy. I have not been on in a little bit because of the holidays, and then I got back from the holidays, and I have just been so busy trying to catch up with my patients and then also get my house ready for this beautiful baby that is on the way. So I wanted to come on today. I had a moment between patients, and I want to do a video about, I need you all to understand the importance of how we need to be doing our Kegels. So when it comes to the pelvic floor, a lot of people, what they fail to understand, and this is not just people, this is other healthcare providers, this is other physical therapists, and this is also a lot of gynecologists. In my area here in St. Pete, Florida, there's gynecologists who have nurses who do pelvic floor PT. And I'll be honest, I am not a fan of it. I think it's absolutely ridiculous. They don't know what the hell they're doing. And so a lot of people will say, oh, I tried PT at my gyno and we did biofeedback and I never got better, or it didn't work. So then I had to go get a bladder sling surgery performed. And when you talk to them and find out what the hell they were doing for their plan of care, you will find that most of the time they're doing their Kegel exercises, their pelvic floor muscle exercises. They're using biofeedback, but they're doing them all lying down on the mat. Maybe they're doing them sitting. So they're only doing them lying down and sitting, and then they wonder why they don't get better. Well, when people have a weak pelvic floor, there's typically two things that are occurring. Number one, they probably have urine leakage. So they're leaking with like a cough, laugh, sneeze, running, jumping, or they might also have a prolapse, a pelvic organ prolapse, meaning that the bladder is coming down, the cervix and the uterus is coming down, or maybe even that rectal wall is coming up into the vaginal cavity, which really is not comfortable, and it affects your bowel movements. And that happens more common after a tear from vaginal delivery. Okay, so those are the reasons why most commonly we see people need to strengthen their pelvic floor, and we see this at all ages of life. So women who, are younger and having children, you 100%, if you ask me, need to go and get pelvic floor PT to rehab the pelvis, especially if you plan on having more children. And having a C-section, by the way, it doesn't mean that you does not mean that you don't need to strengthen the pelvic floor. Okay, a C-section does not mean the pelvic floor has been protected. You still need to strengthen the pelvic floor because the baby was sitting on that muscle for a very long time. And then as we age through life, most women don't do their Kegels and they don't really think about this area. And when we get to be at our late 50s, normally around our 60s, we start to have issues. And that's when we really start to have a lot of urine leakage, a lot of urine urgency, and also that's when the prolapses become very prominent. And what most of the time happens is your gynecologist is gonna say, we need to do reconstruction surgery. And I'm gonna tell you guys right now, if you actually see a real qualified pelvic floor physical therapist, you will not probably need to have reconstruction surgery. I have treated women in their late 60s into their 70s who have very bad prolapse, who have very intense urine leakage, and they get better in about 6 to 8 weeks with a proper pelvic floor Kegel program. But the emphasis here is proper, meaning we can't just do it lying down on a mat and sitting down. If you're doing Kegels and all you're doing is them still while lying and sitting, you are not going to get functional results. So what do I mean by functional results? Most of the time when people have urine leakage or the prolapse, this is happening while they are standing, not when they're sitting, not when they're lying down. So if I'm having symptoms when I'm standing, then we probably should do Kegels while we're standing to make them functional. So the reason for this video right now, my little rant, is I want to emphasize today and in this moment if you are having any of these issues and you are doing Kegels, you need to be doing them standing up. Now, if you're really weak and you don't have a strong pelvic floor, you cannot start standing because standing is harder. You have to start doing them lying down. You progress to sitting. Hey there, Erin. Then you progress to standing, and then you progress to doing them with functional exercise. So I then teach my patients while hooked up to biofeedback, how do we now do a proper Kegel with movement and with breath coordination? When we coordinate our movement with our breath and our pelvic floor, that sounds really complicated. I promise you it's not as complicated as it seems when you're trained appropriately. But when you combine those together, our pelvic floors are awesome. And the pelvic floor muscle is the #1 support tissue for all of our organs. Think about it like this beautiful trampoline that's holding all of our organs on top of it. Well, as we age, if we don't strengthen the pelvic floor, it becomes a really saggy trampoline that has no bounce to it. And then we can surgically tack it up. So now imagine there's like a tree over that trampoline, and I just took that saggy mat on the trampoline and I tacked it up. Okay, that helps, but the trampoline still has no elasticity to it. It still isn't strong. It's just being held up artificially, and it doesn't have very good movement. That's what we're doing when we have surgery. Or you could take that trampoline and you could give it some exercise, if we could do that, and you could make that trampoline become nice and beautiful and tight again and elastic to where it can depress down and it can stretch, but it can also rebound back up. And that's what our pelvic floor muscles need to be able to do to support our organs. We've got a bladder that sits on top of this, a vagina, and then we've got our rectum. Well, the bladder needs to be able to expand and contract. The vagina needs to be able to stay contracted and expand for intercourse and for babies. And the rectum needs to be able to close, collapse, and then be able to expand when we have to have a bowel movement. So we need a lot of movement that's contracting and expanding in the pelvic floor. Well, that's not very good if we have a saggy trampoline or if we have this artificially tacked up trampoline. So if we can make the trampoline nice and beautiful again and have some good elasticity, some good rebound, we're good. Women, we're totally good. But we can't do that lying down and sitting doing a Kegel program. If you're doing that, if you've done that in the past and you think you've failed pelvic floor PT, it's not that you failed it, you just haven't done it properly. So that's my message for today, my little rant that's been on my mind. Because I just don't like misinformation, and I want you all to understand that our bodies are freaking awesome. They're so amazing in their ability to rehab, but you do have to know what the heck you're doing. Okay, I hope you all have a beautiful rest of your weekend. Thank you for anybody who listened, and please share this knowledge with your friends so that way we can all as women stay protected and keep our pelvic floors nice and healthy, and I can keep you guys out of the ER and away from surgery and away from all the problems that come after surgery that then you have to come see me for anyways. So let's just avoid that whole step. Okay, bye guys.